I couldn't talk. My right arm, my left side of my body had gone to a standstill. I couldn't move in any direction. And I phoned 999,
Okay.
which paramedics come, thought it might be a stroke, and brought me directly to Valley,
Okay.
which then passed me through the various
Tests, yeah.
tests, and they confirmed that I'd had a severe stroke or critical stroke.
Okay.
And then I had problems with my right knee,
Yeah, that's right.
which swelled up and prevented me from having any flexibility.
Okay, so you couldn't engage in rehabilitation because of the painful knee.
Patients that have had a stroke often suffer from disability following a stroke, even if successfully treated, and therefore they will require the input of several therapies, so speech and language therapy, physiotherapy, occupational therapy, are all working together as a team to maximise the speed of recovery and the quality of recovery that those patients can achieve.
So do it up and down, that's it, and then put it up, and then push down. Good.
An important part of stroke treatment is the therapy afterwards and the intensive input of a number of allied health professionals into the care of the patient. Many patients, even with successful stroke treatment, are still left with some residual disability following their stroke, and therefore they will require intensive physiotherapy, occupational therapy, speech and language therapy in particular. So all of those resources are concentrated around the stroke patients in the stroke ward to ensure that they can get the best outcome from their recovery. If a patient's coming into our hospital with signs and symptoms suggestive of a stroke, they will come to A&E first. They will be seen immediately with a suspected stroke, and they'll be seen by a member of our stroke specialist team here. Then they will then begin the process of further investigation and treatment specific to their stroke condition. The consultation began because Kent and Medway were aware that their stroke services were falling behind the rest of the country, in that they weren't sufficiently concentrating their resources in a smaller number of units to deliver what's called a HASU, which is a hyperacute stroke unit. The ability to have a larger number of patients looked after in a smaller number of units means that you can also concentrate your workforce and enable you to deliver a 7-day, 24/7 service, which is aligned to better patient outcomes. That's what we're trying to achieve in Kent and Medway. In the existing arrangements, once patients go into our stroke ward, we don't, as you know, we don't have a HASU here at the moment, but once they go into our stroke ward, they're then managed by that team which focus on the care of the patients in that ward, and they will stay there until they're ready for discharge from hospital. Currently, in Kent and Medway, we have 6 hospitals all delivering stroke services. Those hospitals are not delivering it in a way that much of the rest of the country is delivering it, which is to concentrate into a smaller number of sites in order to improve the access to skilled clinicians throughout the whole week, and also to increase the number of patients being looked after in those sites, to increase the skills and the resources available to those patients. So from a patient's perspective, they may find they have to travel a little further, but the intention will be that if they go into a HASU, that they will get 24/7 access to highly skilled staff and imaging and treatment that they wouldn't otherwise be able to, for certain, access in the current arrangement. I think it's very important that the public get involved in the consultation because this is their service. Many of the public have used the stroke services, most of them do use healthcare resources, and I think therefore they have a right to have a say in how things are decided. I think the important thing for the public to do is to make sure that they're comfortable with the way we have recommended stroke services should be laid out. A lot of thought has gone into the possible options, and the public should take a view on that, and the public have a right to have an opinion on that.